Do you suffer with heel pain or plantar fasciitis? Make sure you watch this video because I'm going to show you our top 3 tips that are based on research on how you can help to address your plantar fasciitis. And then I've got a special offer for you at the end of the video, so make sure you watch the whole video. So we have over 18 years experience successfully treating heel pain and plantar fasciitis, and we can do it without orthotics, without drugs, and without the usual restrictions of limitations, and you can keep doing the things that you love. So the first thing I would do, particularly if you get pain in the mornings from your heel pain, is I would stretch your calves like crazy. So I would be doing this one in particular, that one, because, and you might say, well, what the hell does it have to do with my plantar fasciitis or heel pain? So your calf muscle, we know it's usually 30 to 40% of the problem. Your calf muscle comes down here, attaches into here, and it pulls on the plantar fascia and increases that micro tearing. That's part of the reason you get so much pain in many cases, particularly when you wake up in the mornings, or particularly after you've been sitting for say 20 or 30 minutes and you get up and you're really sore. So that's the one I would do. 20 to 30 seconds, 3 to 5 times a day for 3 weeks. If it doesn't improve after 3 weeks, you're going to need more professional help. So make sure you watch the whole video. I've got a special offer where we can help you if you've got that sort of chronic plantar fascial issue. The next one is more of a loosening thing. Now this isn't for the faint-hearted. It might hurt a little bit, so I'll show you an adaptation if it hurts too much. So the way we do this one is you walk along, and when you hit a sore spot, stop. 1, 2, 3, 4. This is going to break up that tightness. Now what's been shown is plantar fasciitis and heel pain, it loves tough love. So it likes to rejuvenate through that issue. So unless this is absolutely excruciating, you should be okay with it. If it's too much, do 1 foot at a time. So almost hold on to a chair and a table, and you sort of walk along a little bit sore like that, okay? So just like that, all right? So that's top tip number 2. So that's a fantastic one, and I would do that particularly before you're active. It'll loosen up all of those fascial tissues. It actually loosens you up all the way up to your neck too, because it releases the whole fascial chain. The next one is, this one is very heavily researched, pretty much shown to be the best plantar fascial exercise. In some cases it can flare people up, so just be aware. But you might be surprised at how weak you are through your arch and your ankle when you do this one. So you get yourself a towel, get yourself a step, any household step is fine, and something to hold on to. So household steps work well because you can hold on to a railing in most cases. So you put your toes here, and you go down, 1, 2, 3, up, 1, 2, 3, down, 1, 2, 3, up, 1, 2, 3. So you're doing that 3 seconds down, 3 seconds up, 10 times twice a day. So if your symptoms persist longer than 3 weeks, we know that you're probably going to need professional advice. You're going to need someone, an external influence, to get in there and address the underlying cause of why you get the heel pain. If that's the case, hit us up about our 65% off heel pain assessment, just $35 instead of the usual $100. And what have you got to lose apart from your heel pain?